Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Everybody, and welcome to the MMOA podcast brought to you by the Institute of Clinical Excellence. My name is Ellen Seppi. I am from Littleton, Colorado. I'm a physical therapist. I hope that you had a wonderful Christmas and a wonderful Hanukkah. Whatever you're celebrating tonight, I hope it was fabulous. Thank you so much for joining me. Tonight we're going to be talking about GLP1 medications and some of the specific concerns for our senior patients. So if you're like me, you care very much about our senior patients, and those entering those specific years have a certain set of concerns that impact their health. One of them is osteoporosis and the risk of a fracture with a fall. So we're going to be talking tonight about how the new class of GLP-1 receptor agonists, or the Ozempic, Wegovy medications that are helpful in treating obesity and diabetes impact a very specific concern for our seniors, which is their risk of fracture. So I hope that we can have a good conversation tonight about how these medications impact fracture risk and bone mineral density. But think of it kind of like a research charcuterie board. We're going to be referencing a few different research articles tonight. They're going to be in the comments, whether or not you're watching this on Instagram or podcast, or if you saw the link in the MMOA digest, you'll get those links in the body of the email. So I kind of want to bring up a few different points here. We know that those with low body weight or low BMI are at a higher risk of fracture and a low BMI or bone mineral density. So we understand that there's a protective effect of having a higher body mass on bone mineral density. So I kind of want you at the end of this discussion tonight to be able to answer the question, does taking an anti-obesity medication impact your risk of decreased bone mineral density and fracture? Is there some inherent risk that we're not seeing to our senior patients who want to manage their weight for lots of different reasons with these medicines? So I want you to stick with me tonight, and I'll give you a kind of a quick synopsis of the research, and then we'll answer that question together at the end of this discussion. So bottom line, we know that those with low body mass have lower bone mineral density and are at higher risk of fracture. We understand that a lot of other health habits like smoking, excessive alcohol consumption increase fracture risk. And so does taking a medicine like GLP-1 put those people in harm's way of increased fracture risk as they lose weight? The bottom line here, the take-home message is paradoxically, no. And actually, there are some research studies that would suggest that this treatment actually increases bone mineral density. There's some nuances in the research that I think we as rehab professionals need to understand. So we know that, having a higher bone mineral density is protective against fracture, and having a higher BMI in general is associated with a longer duration of survival with disability among older adults. So basically, we want to fight frailty and preserve somebody's lean muscle mass as they're losing weight. We also know that there's a benefit to cardiovascular risk, mortality, and kidney outcomes from the MACE study in those who are taking GLP-1s and those with type 2 diabetes. So we understand that there are benefits to these medicines in regards to longevity, overall mortality, especially if people have diabetes. How does that impact bone mineral density as it decreases somebody's weight? So we know that as people lose weight with these medications, they are losing muscle mass as weight comes off. And exercise, vitamin D, high protein diets, which that's kind of our wheelhouse to really advocate for in our patients who are on these medications. That's our job. If you really manage the dietary and exercise component, you can preserve muscle mass while you're on these medicines. But there's some nuance to understanding how this impacts bone mineral density. So you would think when you lose weight, you lose bone and you lose muscle. Two things that are vital for our older patients' survival. And unfortunately, that is true. When we see our senior patients losing their bone mineral or losing weight, we often see that come with loss of muscle mass and bone mineral density, which is dangerous for our senior patients. And our ears should be perked as we're understanding that risk to their overall health. But interestingly, these medications, these GLP1s, the Wegovy, Ozempic, they impact bone mineral density, and there's some preliminary evidence that they don't actually decrease bone mineral density, but they increase it as people are losing weight, specifically in diabetics. So understanding that taking this medication, even though it might stress us out as clinicians to see somebody's scale dropping, actually might have a protective effect on their bone mineral density is something that we should be aware of. Another nuance in the research is that even though we were potentially seeing increases in bone mineral density, unfortunately, this does not necessarily translate into the prevention of fractures. So pragmatically, we don't have the body of research to suggest that people who are taking these medications are actually experiencing fewer fractures. So we can't necessarily say to our patients, well, if you have obesity and you take this GLP-1 med, maybe you're going to have a lower likelihood of having a fracture. We still have a role to play in our patients' lives to maintain their bone mineral density and their muscle mass. What does that look like? So if you have a patient, I'm going to really leave you with this charge here, that if you have a patient that you know is a senior who is taking these medications, you have an extra job. You have an extra job to really advocate for them to maintain a healthy lifestyle in regards to protein intake so that they can maintain their muscle mass as they're shedding adipose tissue. So your job is to advocate for that protein intake. It is so within your scope as a PT or OT or personal trainer to fuel that tissue and make sure that they're maintaining their muscle mass as they're losing weight. Additionally, it's our job to, if you're an outpatient clinician, you're treating somebody for neck pain or hip pain, which this happened to me within the past week. I was treating a patient and I've been treating him for shoulder pain and neck pain. And we started talking about these new medications and how game-changing they are for a lot of people. And he said, actually, yeah, I've been taking it for a month and a half. And I'm like, wasn't on your intake form, my friend. I didn't even know that. So we switched our gears. First off, I was like, that's great. I'm so here in your corner to encourage you to keep managing your weight with whatever means you and your doctor have talked about. I want to be in your corner for that. But man, knowing that you're going to be losing weight, I can't just do joint mobs here and massaging your neck. Now, this is 3 times as important to make sure that we're doing exercise and talking about protein to maintain your muscle mass as you're on a medication that might inspire your body to get rid of that tissue because it's expensive to keep on payroll. So I have a new charge for you. If you find out that your patient is taking one of these medications, really absorb that and say, okay, we now have a new job. I know that your doctor has talked with you about how important it is to exercise and to get enough protein. Now you have another person saying it's important and I'm going to show you how to do it. It's important and we're going to practice it in the clinic. It's important. Yeah, I'm going to work on your neck and your shoulder. But if you want to keep your muscles as a senior patient, as a senior person while you're taking this medicine, you and I have a job to do. Because we know that combining exercise and GLP-1 meds is even more impactful to preserve muscle mass and improve body composition. So take home messages from tonight, guys. Number 1, our patients are taking these medications and they're using them for a lot of different reasons to improve their health. We've got to be in their court and make sure that we're supporting our patients through as many different avenues as we can to teach them how to exercise and teach them how to fuel their body so that their body can keep that vital muscle mass, which is protective. So number one, we have a job to do with our senior patients. Number two, it is a misconception to assume that taking these medications negatively impacts bone mineral density. So taking a GLP-1 medication does not mean that bone mineral density decreases. In fact, paradoxically, it actually improves bone mineral density. But point number three, that doesn't necessarily come with a decreased risk in fracture risk. So we cannot make that assumption that going with this GLP-1 medication is going to inherently decrease your risk of fracture. So team, I'm so grateful that you're here tonight to really dive deeper into what helps our senior patients as they're taking medications to improve their health. And I'm so glad that we're caring for vulnerable populations, those seniors and those with obesity who are trying to do their best. I'm so glad to know that I'm joined by people who truly care to help their patients meet their goals. So thank you very much for joining me, and we'll hope to see you next time. Bye.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.